Hello, I'm Dr. Aron with Seaview Orthopedics. I'm an orthopedic surgeon that specializes in care of the foot and ankle. Fellowship trained at Allegheny General Hospital in Pittsburgh, Pennsylvania. Going through training in a general orthopedic residency really taught me that most specialties in orthopedics focus exclusively on 2 or 3 procedures. Foot and ankle is a specialty that has a multitude of procedures, and some of those procedures are done relatively infrequently. I found that very interesting. It was nice always doing something a little bit different. It is rare that at times I may do procedures one week and not do it again for another 6 months. And I found that very interesting. I like that variety and that breadth of surgical experience that's not present in other subspecialties of orthopedics. What I find most rewarding is really getting people to walk pain-free again. A lot of what I do is limb salvage or reconstruction. I have patients that come to me unable to walk for a multitude of different reasons. And it's very gratifying to see them walk out of my office at their last final follow-up. So patient care is interesting. There are 2 different philosophies. There are lumpers and splitters. With regard to lumpers, people see a disease state and treat it all the same. I tend to be a splitter. I tend to look at the pathology state, and I also tend to then look at patients' characteristics, comorbidities, and treat every patient as an individual with individual needs and individual wants. So I'm really passionate about almost everything in the world of foot and ankle. I do particularly enjoy fracture work. It fits in with every time it's a little different. No bone breaks the same every time. Of course, there are similarities, but each case is a little bit different. I find that very rewarding. I do like Achilles work because that's also very interesting, especially with degenerative changes of the Achilles, not necessarily just ruptures. So staying current is always important. I tend to do a significant amount of reading, but in addition to reading, I do work with industry. By working with industry, you work with other foot and ankle surgeons at a very high level from across the country and even around the world. And when we're kind of in a lab working, we just talk shop and you go, wow, that's a great idea. Why didn't I think of that? Or, wow, that's a good idea, but why couldn't you do it this way? And that starts to lead to a lot of innovation and new procedures and even new surgical equipment that can be used to make procedures done faster, better, safer, and more reliably. Thank you for taking the time to watch this video. Continue to follow this channel as we will be updating it. The goal is to post interesting cases, new developments, new equipment, things that are interesting in the world of foot and ankle happening at Seaview Orthopedics. Thank you so much.